Right. I'd like also to acknowledge Ian Maxwell. Ian's here, who is our coordinator in response to the COVID-19 situation. Claudia Weiss, who is our Director of Customer and Community Services. Chris Brooks. I'm looking into lights here, so I think Chris is here. He's right behind the lights, that's why I can't see him. The Chief Executive of Regional Facilities Auckland, and Merla Edmondson, who is our General Manager of Libraries, and Mace Ward, our General Manager of Parks, Sports and Recreation. The announcement that I'm making today, that as of later today, our libraries, our pools and recreational centres, as well as the Art Gallery and the Maritime Museum, will be closed. They will be closed initially for a period of 2 weeks, with that period extended depending on what the current situation is at that time with the spread of COVID-19 and the advice that we may receive from the Ministry of Health. Making that announcement is something that we do with regret, but the announcement is both important and necessary. Our library facilities are hugely enjoyed by the people of Auckland. Each week there are 250,000 visits to our Auckland Council public libraries. Each week there are more than 200 visits to our pools and to our recreation centres. But the very scale of those visits indicate the potential risk of the spread of COVID-19. At the moment, as everybody is aware, COVID-19 has not gone through people-to-people transmission within our community. It's been restricted to date through good management and some good fortune, simply to contact with people who have returned from overseas. We cannot, however, rely on that situation continuing indefinitely. There is a risk, and we need to be ahead of the curve in responding to that risk. Our announcement today is also in line with the advice given by the Ministry of Health through government yesterday that gatherings indoors of more than 100 people need to be restricted. As much as we love the services that we are closing down, our main concern and our key priority has to be keeping people safe and doing what we can as an organisation to constrain the spread of COVID-19. The options we have looked at to try to maintain social distancing within facilities such as libraries has demonstrated that we cannot provide a guarantee with the sheer numbers that we're getting through our libraries that these are not places where transmission could potentially occur. During the next 2 weeks, we will be looking at creative options for libraries and other facilities to see if there are different ways in which we can make these services available. And I'd like to draw everybody's attention to our e-lending services at libraries. We have literally tens of thousands of books that can be made available online through the use of a digital library card, which are easy to download. So we are very keen that people take advantage of these services. We're conscious of, at this time, that people can become very socially isolated, and that's one of the reasons why we were regretful about the need to make this decision. Our libraries are used by many older people in the community. But of course it's that older category of people as well that are most vulnerable to the spread of COVID-19. So while it may be a jump for some people to encourage people to take advantage of our e-books is one way in which we can compensate for the loss of the direct service of the lending of physical books. I should add that there will be no fines for the delay in returning books over the initial period where the libraries are closed. The final point that I'd like to make is that The closing of these services will not impact on the loss of jobs of our permanent staff, either full-time or part-time. But we will look at using some of the freed up time on the part of our staff to be redeployed into other areas of council work and potentially into other areas where it may become necessary if COVID-19 is to become more widespread, for example, assisting other public service agencies, including our district health boards. Those are my initial comments. Alf, is there anything you'd like to add to that?
Just one thing, and it's about our staff in the libraries and the rec centres as well. It's about keeping them safe. So not only our general community, but as well as our workers in the libraries and rec centres. So it's about them as well.
Absolutely. This is about protecting the wider public, but of course our first priority is also to protect those who work for us, and they are dealing day to day with people. Can I just make one distinction that I should add? These are important services. They are not in the category of essential services for people to be able to meet the necessities of life. So we differentiate between what we're doing in these areas with, for example, the ongoing advice that public transport will continue, albeit with higher levels and a greater frequency of cleaning, and the closure of other public institutions such as schools and universities. So, open to any questions.
It's been nearly 24 hours since the government's announcement, and clearly from comments you and others made that you were expecting that announcement. I mean, is 24 hours a long time to implement this kind of thing? Last night?
Yeah, look, we've got to understand why the decision has been made to restrict the gatherings of people indoors to less than 100. It's not because we are already facing people-to-people transmission. There is as yet no evidence of that, but it is remaining ahead of the curve, and I think to fully implement that recommendation within 24 hours is a safe and a reasonable thing to do. Other questions?
Can you just talk, sir, more about the job situation? So people who work at these places don't need to worry about their jobs at the moment?
No, our permanent staff at our libraries and our recreational centres, both full-time and part-time, will not be at risk of losing their jobs. There may be some redeployment in the future as they can find work in other parts of the council organisation. There's also the potential, working with central government, to make some of the freed up staff time available to help deal with the COVID-19 crisis, for example, assistance to our DHBs.
So what are they doing now? Are they taking paid annual leaves or sick leaves?
No, there'll be work that's still available to do within our recreation centres and our libraries. All of that work doesn't disappear, but it reduces as the number of people reduce to zero coming into those centres. So we have the availability for people to take the leave that they are owed, but what we're looking at primarily is whether we can redeploy that staff into other necessary work within the council arena. New pressures are being created, such as by COVID-19 itself, but also to redeploy, if necessary, to the public service in areas like the district health boards. Those are potentials that we are looking to explore over coming days.
So has anything like this been done in Auckland on this scale before? Is this unprecedented?
No, we're working in unprecedented times. There are no rule books for what our country and in fact the world is going through at the moment. I'm proud of the fact that in our country we have been proactive. We have worked very closely with the Ministry of Health and the experts in the Ministry of Health. They provide guidance to us on what is necessary to protect to the maximum degree possible the health and well-being of our citizens and, as Alf mentioned, our staff.
Are you able to deploy things like the mobile library more or in different ways?
We're looking, that's a question I asked myself this morning, we're looking at how That may relate to the ongoing use of mobile libraries. Again, the decision that will be made in regard to the mobile libraries will be to do with not only keeping under the guideline of less than 100 people in one place, which is easy to do on a bus, but it is also a very constrained environment, and to work out whether we can maintain the correct level of hygiene and social distancing to keep a part of those services going.
Is this going to be something that's going to be played by ear throughout the 2 weeks, or will it be communicated through the 2 weeks, or will it just be reviewed by the end?
I think we'll be looking at continually reviewing. It's a little bit like our response to COVID-19 as a whole. We're handling it to try to keep ahead of the curve, but we are flexible to how we might amend those policies from day to day. If the situation were to deteriorate strongly, then we would lift the level of our response. As the situation gets better, and at a certain point it will get better, we'll be looking at how we can reinstate those services in a safe way as quickly as possible.
Can you explain the distinction between, for example, the confined space of the mobile library and continued normality around public transport?
I think the critical difference is that a service such as public transport is an essential service. People have to be able to get around their community, to get to work. That includes the people that are working in essential services themselves. I know a lot of nurses, for example, at a place like Middlemore get to work by public transport. And cutting down public transport is a last but very serious step to take. Even in the situation in Paris and in London, the services have been reduced but not cut out. And I know from discussions with Auckland Transport that they are moving on an ongoing basis to improve the safety, to increase the social distancing where that is possible, and to lift the hygiene levels and the cleaning levels that are being undertaken in public transport. So work is happening in that area. But to close down all public transport could be to bring the whole of our city and our country to a grinding halt, and clearly that's not desirable.
I see you've made the distinction here that it operates independently, but is it strange to have all these places closing but the War Memorial Museum staying open?
Yeah. We are in touch with the War Memorial Museum. We are the major funder of the museum, about 83%, but they operate under a different statute, and that statute says that the decisions that are made operationally are made by them and not the council. So yes, we will share information, and yes, they will be mindful of all of the same factors that we are, and that will include the need for social distancing within their facility. But to get a direct response from them, it's appropriate that you talk to them, because they are under law the decision maker and not the council.
But you as the mayor, would you urge them?
I would urge them to follow all of the same procedures that we are following to keep people safe. They, in the end, must make the judgment as to what it's necessary for them to do. I know that patronage at the museum has declined quite sharply, and I know that things such as events being held at the museum have been cancelled. Okay, I think we've probably, as I mentioned before, we've got key people here if you want more detailed information from our staff. Is there anything that anybody that's here would like to add to the comments that I've made today? Otherwise, I think feel free to talk to people individually and get their background on specific information. I think I see Stephen Town here too, who I neglected to introduce at the beginning. Stephen, thank you. Okay, thank you very much. Thank you, my friend.
No, that's all right. Like I said, it's just a support.
No, that's
definitely.
Before, we'll probably be told to go into isolation. So clubs have been knocked out for at least 14 days, or told to somehow find another 17 to 20 players to come and.
Sounds like we might just be losing the Skype line there. Can you still hear me, Sam?